Perinatal behavioral health is the health period, the behavioral health period surrounding pregnancy and postpartum. So we deal with pregnant moms here at the Heart Center who have babies who have received a fetal CHD diagnosis, and we also see moms within the first year postpartum. I talk with parents and meet with parents and specifically focus on how they are doing their mental health. So making sure that while we're giving the babies really good top-notch medical care, we're also making sure that we're taking care of the whole family and that the parents are in a good space. The idea of mental health care can be intimidating at first, but generally once we've started talking and they realize we're just talking about how their emotional life is doing and how they're coping with their baby's treatment, usually families are pretty receptive to that. I really try to be pretty flexible about my encounters. I'm available to talk to people by phone to offer support services. I am available in person at the bedside in the Heart Center, and I also do have an outpatient clinic where I can meet for therapy appointments as well if that's something that's appealing. In our case, we have been very fortunate to have the support of the Ollie Hinkle Heart Foundation and Eden's Army, who help fund my role here at the hospital and really place a high valuation on making sure the parents are getting the support that they need. So while we are giving the babies great medical care here, the team also feels like it's really important to make sure that we're caring for the whole family system. And the analogy I always use is that you can't take care of anyone else until you've taken care of yourself. So if you're on an airplane, they tell you put your mask on first. And that's why I encourage parents to engage in mental health care, self-care activities, that type of thing, in order to make sure they're in a good place so that they can give with their baby what they need. There is a stigma that can be attached to receiving mental health. I think that I have been really fortunate to work with a lot of families who are pretty receptive to talking about how they're feeling and doing and coping with their baby's diagnosis. I think it's a lot like going to your primary care physician, checking in, making sure that your emotional life is doing well, as well as your physical health.